Hello everyone. So today we are going to have a session on the new treatment methods in the field of rheumatology, and we have Dr. Madan Mohan here with us. We are right now at his clinic and we are going to discuss more on the topic. Hello doctor. Basically we want to know what is new in this treatment. Uh, what is the new treatment in the field of arthritis right now?
Okay, we have now lot of drugs, which are in this field, and the outstanding drugs are something called biologicals.
What are biologics?
See, the point with biologicals are actually natural drugs. They are produced by living cells. See, for example, our insulin is produced by our pancreas cells. So what we are doing here is we are taking the gene for the particular protein, we insert it into the cell, and the cell then will produce the compound, and this is then purified, centrifuged, and then we have the natural drug. So what we are trying to do is the natural drug. So that is what is called biological. So they are very natural drugs, just like what our human body or our body is doing. So these cells are not, these are actually not produced, they are made actually by these cells. So that's the difference about biologicals.
Okay, so then how are they different from the traditional drugs that that are there?
So the traditional drugs are usually chemicals, they are synthesized. So they are synthesized, and they have very simple molecules. They are very simple molecules. This chemical structure is very simple, while biologicals are usually very large molecules. I can show you some pictures here if you are interested. So see here, this is one biological. This is a very large structure, while a chemical, in a normal chemical, is a small molecule. So these are like comparison is between a small car and a jumbo jet. So that's the difference. So another difference is it usually targets a certain chemical or enzyme, what do we call a cytokine. While chemicals act on different pathways, here they act on a specific molecule. So that specific molecule gets blocked. So it's something like a cruise missile. You target this specific enzyme. So that's the difference.
Okay, when are biologics preferred over the traditional drugs? When do you prescribe it to a patient?
So we prescribe to patient when the traditional drugs. So in rheumatology we call them conventional drugs, conventional synthetic DMARDs. DMARDs means disease modifying anti-rheumatic drugs. So these are the conventional drugs which are mostly small molecules. As I previously explained, they are all chemicals. So once they are failing for a particular patient, patient is not having any good with that. Patient has failed, patient still has joint damage, or even on the small molecule, then we have to go for a biologics.
So are you saying a biologic is more effective than the traditional drug?
Yes, in many ways it can be a bit superior because they are known to stop joint damage more effectively than the conventional drugs.
Okay, so if they are more effective, why are traditional drugs still used? Why are doctors not prescribing biologics initially, like the beginning of the treatment?
See, that is because of the various reasons. Because some percentage of patients will respond to traditional drugs. Not every patient will require a biologic. There are certain patients who will respond to traditional drugs. So initially, even because of the cost factors, even because of the cost, it's always good to start with traditional drugs. Because some patients will respond to traditional drugs. You don't have to go for a biologic. So it is also always considered a second line. When our traditional drugs all fail, we prefer that.
Okay, so are biologics more effective when they are taken along with the traditional drug or purely biologics?
There are some drugs which can be taken alone, stand alone, monotherapy, we call it monotherapy. That means the drug can be taken alone.
Okay.
While there are drugs which are more effective when we give along with the traditional conventional synthetic DMARDs.
Okay. So how are biologics administered? Like how is it given?
They are usually not tablets.
Okay.
They are given as either infusion like drip. For example, I will show you this. This is one drug which we give as infusion. And this is actually blocking the B cell. So this is very specific. So that's why we call it as targeted therapy. This blocks only the B cell. So this is called a B cell inhibitor.
Okay.
So that's why they are more specific. So this is given as a drip infusion. Patient is given through an IV line. And there are many biologics which are like this. While another set of biologics we give as subcutaneous injections, just like insulin. And some are given weekly, some are given bi-monthly, some are given even monthly. So there are various types of biologics. So usually the infusion is two types. One is infusion, the other is by subcutaneous route.
Okay. So now you just said that a biologic is given when traditional drugs fail to work. So what happens if the biologic is not working for a patient? What is your alternative for that?
Okay, now there are more things than biologics. We have got something called targeted synthetic DMARDs. Even they are coming as tablets.
Are they biologics or?
They are biologic, but only thing is you may call them oral biologic. So now we have got something called oral biologics. They are also working very specifically. They are again targeted enzyme inhibitors. So we have got a lot of biologics. Even oral biologic is there, not even only the injection. They are nowadays called targeted synthetic DMARDs because they are conventionally not like injections. So they are a new class. We have something called JAK inhibitors. They are considered to be high-grade biologics, or maybe we can call it the newest biologic.
Okay.
And they are available in India also.
Okay. So can biologics, cure arthritis completely?
So biologics are just like any medicine only. They can only bring remission.
Okay, not complete cure.
It is not possible for most of the chronic diseases like diabetes, blood pressure, even cholesterol. Most of these diseases you cannot cure completely. Only thing is you can bring it to total remission. That means there is no disease activity. That means there is no further joint damage. So you can what you call as put the disease into rest or sleep. So the disease is no more active and there is no further damage.
Okay. Do biologics work differently with older and younger patients?
No, it works for both. Even it can be given for children, pregnant ladies. It can be given. We have got juvenile.
As in, are the chances of biologic working more efficiently in young people more or?
No, there is no difference.
There is no.
You can give for we have got something called juvenile idiopathic arthritis. That is juvenile arthritis, which can happen before the age of 16. So we can give biologics. Biologics are approved in children. So they are as good or as effective as in adults. There is no difference.
Okay. So the next question is something every patient will be very curious. What are the side effects of biologics?
Side effects, see, if given under supervision, we have no problems with infusions usually. And of course, the side effects are just like side effects with any other drug. Even oral synthetic DMARDs have side effects. So you can only expect something like that only. They are not toxic, more toxic than the oral drugs.
Okay.
Only thing is they have to be taken under supervision. There should be somebody who is trained to give them or supervise them. So patients have to be vaccinated. So they have to take the usual precautions. In fact, they should be on less steroids. And the great thing.
What are the usual precautions that are given to patients when they are under this treatment?
See, they are supposed to take all the required vaccinations.
Okay.
And then they have to have regular monitoring under the physician.
Okay.
They have to report to the doctor in case of any symptoms. So they have the usual problem. They have got some of them may have unusual reactions, but every reaction has to be reported to the doctor. Most of the reported reactions are rare.
Okay. When I was reading about biologics, I came across the statement that malignancy or cancer is a risk with biologics. So
no, that is actually now there are a lot of large studies showing that the chance of getting a cancer, that is even people say lymphoma, blood cancer, all this is not increased with biologics. In fact, what happens is rheumatoid arthritis itself is associated with high chance of lymphoma. If a patient is getting a lymphoma on a biologic, it is because of the rheumatoid arthritis.
Okay.
Usually uncontrolled disease only causes lymphoma and all.
Okay.
Because now it is very clear, because biologics are there for a long time now. They have been in existence since the mid-90s.
So why did it take such a long time to,
No, only thing is it's slowly evolving. A lot of new biologics are coming, and new companies are making, and now we have something called biosimilars, which are copies of the biologic, which is bringing down the cost of biologics. So it's slowly, the field is slowly evolving.
Okay, so biosimilars are like an alternative for biologics, or what is it exactly?
Yeah, they are intended copies.
Okay.
So only thing is it's not the process is a bit different. It is not exactly the biologic. Only thing is we are trying to make copies. So the point is then the cost will come down. Most of the low income countries, biologic, even in European countries now they are using biosimilars.
So are biosimilars, chemicals like the traditional drugs?
They are same. See, the point with all this is done in bioreactors. So there may be slight difference in the molecule. But the process of making biologics is very complex. So the biopharmaceutical is not exactly similar. They can be having minor small difference. But clinically there will not be much difference. So nowadays the trials are done in patients, and even a slight molecular difference is not a problem. Only thing is they should show the effectiveness. For example, countries like Norway is now using biosimilars.
Okay. So are they more effective, or
they are as effective as the biologics?
Same. Okay. So how expensive is this method of treatment?
Yeah. The point with the biologics is they are a bit expensive because it is due to biotechnology, and the cost of production is very high because we are trying to harvest the cell in bioreactors, and this has to be done. The technology is very high grade, so the cost of production of these products are quite high, and that is why these biosimilars have come down, which uses something called reverse engineering. There are other processes, so that some of the cost is coming down. In traditional countries like India, we are using more biosimilars, so that it is affordable to a large section of the people. And various biologics cost is different actually. And in countries like Europe and America, insurance coverage is there, while in the UK the National Health Service coverage is there.
So what about our country?
Our country, there is no little coverage, but we are using a bit of biologics in a different way as per our Indian methods.
Okay, so if they are same in their effectiveness, you always suggest biosimilar first to the patient, or you see their economic status and then go for it?
Yes, the economic status.
Okay. So what difference has biologics made for arthritic patients in the long term?
Biologics, earlier the rate of surgery, that is hip replacement, knee replacement, was very high because most of the patients get damaged joints, even if they are on some of these traditional synthetic demands. Now the biologics have changed all that. In European countries, the surgery rate has gone down. That means patients do not have longer, damaged joints, and it is actually good for the heart even. For example, most of the patients die of cardiovascular disease. For example, we have something called TNF blockers. These TNF blockers are known to reduce cardiovascular disease. So in fact, they are cardioprotective. So the long-term outlook of these patients have totally improved. And they are definitely good for the joints. That means the damage to the joint is much less with these drugs. So the outlook of these patients have dramatically changed in Western countries. So that is the hope with these drugs.
Okay, doctor, I think we have come to the end of this session, and I believe this video will be very helpful for all the patients. Thank you once again, doctor.
Okay, thank you for your cooperation.
Thank you.